you. Welcome and thanks for joining us for today's ASA webinar, The Role of Technology in Aging, which is part of the Empowering Professionals in Aging series presented by Home Instead, Inc. We will be getting started shortly. The slides for today's presentation are available under the tab on your screen labeled Resources. And under the tab labeled CE Application here, you will find information on how to obtain CE credit for this event. You will have 60 days to complete a continuing education application, and it may take up to 30 days from the date of your application in order for us to process and issue your CE credit. If you are not logged in directly to this webinar, that is, if you are watching as part of a group and did not log in using an individual confirmation URL, you will not be eligible for continuing education credit because we have no way to track your online attendance. If you'd like to receive continuing education credit, please be sure you log in using a confirmation URL you received after individually registering. If you have questions during the presentation, you can send those at any time using the questions box, and we will save those for the last 10 to 15 minutes of today's program. And now we'd like to welcome today's presenter. April Ibarra is a gerontologist and strategic partnership manager for Home Instead with more than 25 years of experience in healthcare and aging. Ibarra is passionate about improving the lives of older adults through advocating, educating, and providing resources to help them live their highest quality, most independent life. Laurie Orlov is a tech industry veteran, writer, speaker, and elder care advocate. She is founder of Aging and Health Technology Watch, which provides thought leadership, analysis, and guidance about health and aging-related technologies and services via market research, trends, blogs, and reports. Previously, Orlov spent many years in the tech industry, including 9 at the analyst firm Forrester Research. She has spoken regularly and delivered keynote speeches at forums, industry crochet, conferences, and symposia, most recently on the businesses of technology for boomers and seniors. She advises large organizations, nonprofits, and entrepreneurs on trends and opportunities in the aging-related tech market. Conferences on caregiving and aging plus serves as a resource to the media. She is a board member of the National Alliance of Caregiving, board chair of the Dreamweaver Foundation, and vice chair of the Alzheimer's Association's Dementia Care Provider Roundtable. I will now turn it over to April Ibarra.
April? Is April muted?
I think we might. Okay.
She said, hold on.
Yes, so we're waiting. April is will be arriving shortly.
All right. We are giving her a moment.
Yes, for those of you.
Hello? Can you hear me?
Yes, we can hear you now.
Okay, I apologize. And I did hop off my website or my headset because that wasn't working well. Is this communication clear enough?
It's better, yes.
All right. All right. Well, let's get started then. I apologize about the technical difficulties, but I wanted to first of all say good afternoon, everyone, and thank you for joining us today to learn more about the role of technology in aging. I know I say this every time I present, but this is something I'm truly passionate about, so thank you for joining us. Before we begin, I would like to extend a huge thank you to and welcome Laurie for co-presenting with me today. So Laurie, welcome.
Thank you so much.
You're welcome. If you're not familiar with Laurie and her expertise in technology, obviously you heard her bio, so I encourage you to follow her blog, Aging and Health Technology Watch. As a gerontologist, my focus always leans towards the older adults and their needs and how technology can benefit them. I'm thrilled to have Laurie contribute her expertise to this presentation, and our goal is to help guide you in serving older adults and understanding how technology can benefit them and those who care for them. So let's dig into the objectives. And again, let me clarify, are you able to hear me okay?
We're able to hear
someone
you,
has
but we are
complained a little
getting
bit about an echo. Yeah.
All right. If you give me just a second, let me see if I can switch over to the headset now. Hold on just a second. God loves technology, right?
Yep. It's actually, if it weren't for technology, we would not have any problems or benefits at all. So.
All right. I'm back. Can you hear me now?
We can hear you.
Yes,
Yep.
that sounds a bit better.
Okay.
Yeah.
I got the headset back on, so let's see if we can make this work. So obviously today you have two experts presenting different opinions on this topic, so it's going to be very exciting, I think, for everybody. But let's get going on the objectives. We have a lot to cover today. We want to review the categories of technology that pertain to aging and caregiving. And we want to learn the benefits of technology for older adults, understand the adoption of technology, and also the barriers, and also review and discover tips to evaluate the benefits of technology for aging adults. So a broad agenda, but it's going to be exciting, and we're just so glad you're here. So let's start with what is technology. Now, this may seem like a silly question, but innovation and technology can be overwhelming concepts for older adults and their families. At Home Instead, we have companies reaching out to us every day, trying to sell a product or service that they believe will benefit our clients. And even for our team of experts, it's hard to determine what is truly beneficial and how and if it can really assist older adults as they age. Now, I believe that technology combined with human touch is critical to the future of aging. However, it requires a better understanding of the needs, the ease of use, and privacy considerations. So when Laurie and I first talked about, let's first define technology, we boiled it down to the most simplest points. It is something that enables a person to get access to a service or feature that they need. Laurie, you want to talk a little bit about why does this matter, especially now?
Sure. One of the things that I think drives the demand for technology now, and not just the demand of people wanting to access it, but the requirement for organizations to make sure their constituents have access, is the COVID pandemic shone a light on the fact that many people who wanted, for example, to register for the vaccine did not have a way to do it. It also pointed out that many people were isolated in their homes and not able to connect with other people, and technology access, devices or software, was essential for them to interact with other people. It's also important to know something about the demographics of the population. Today in the United States, 46% of women who are age 75 plus live alone. There are 40 million people age 65 plus. And in addition to the COVID lockdown, the size of the population, the need to register for vaccines, managing chronic diseases these days is as much being done inside the home as it is in institutions and hospitals and clinics. And so people also need access to technology in order to better manage chronic diseases. April, I'll turn this next one over to you.
All right, great. So let's keep moving. I want to, I'm not sure how many of you are familiar with this task force and report, but to me it's a promising step towards better understanding technology and aging and building a roadmap. The Task Force on Research and Development for Technology to Support Aging Adults intends to evaluate how technology can maximize the independence of aging Americans by increasing opportunities for social engagement, connectivity, as well as reducing the impact of cognitive and physical limitation. So I encourage you to download and take a look at this report. It is fascinating and, again, promising as we try to look towards the future of how technology can support our older adults. In preparing this report, this task force identified the primary capabilities that older adults must maintain to continue to live independently. For example, the ability to perform key activities of independent living, as well as more focused key areas such as hygiene, nutrition. So there's all kinds of ways that technology can improve the lives of older adults. The report then reviewed the diverse spectrum of all these emerging technologies and systems designed or with the potential to maintain those capabilities within these areas. And then based on this review, they kind of identified gap analysis, and the task force identified functional needs that could potentially be met by new technology. So lots of exciting things related to that. And then they also took a look at 6 functional capabilities that are critical to helping older adults age. And, it's more important now as we start looking at the magnitude of our aging population that we really start to address all the different ways that we can help older adults. And these 6 functional capabilities included key activities for independent living, cognition, communication and social connectivity, personal mobility, transition, and access to healthcare. So they're really looking at the spectrum. And so I think it's just a wonderful way to look. And basically, we'll make sure you have access to this report before you finish. I think it's fantastic. So again, I think it's very promising that we start to look broader. We're not just addressing these needs from a community perspective, but we're looking at everything from a national perspective and how we can help. Okay. Now, we talked earlier. I'm sorry, Laurie?
This is Laurie. I would like to just jump in a little bit about that report.
Yes.
Yeah. So the report was called Emerging Technologies to Support an Aging Population. But one of the key points in the report, which I thought was quite interesting, and you can find it on page 24 about user adoption, was that people in the analysis that the task force members did, they were concerned about whether technology adequately assessed users' needs, did a usability analysis appropriately, and understood how people interact with technology. So while they identified these as the appropriate categories, as April said, that technology needs to support, they did recognize the fact that there are limitations in people's ability to access it. And so I just wanted to point that out before you move on to the next research study.
Absolutely. Thanks. All right. So we talked earlier about getting older adults online has never been more urgent. And, we learned a lot from COVID and its impact on older adults and really the whole world in terms of isolation. We know that technology can benefit older adults, but we can't ignore this elephant in the room, that much work is needed to help get older adults online. And there are some very good initiatives out there that we wanted to make you aware of. If you're not familiar with OATS, Older Adults Technology Services, it's a social change organization. And they joined with AARP in 2021, and basically with the goal of helping older adults to thrive in a digital world. Senior Planet from AARP harnesses technology to change the way we age, offering courses, programs, and activities to help seniors learn new skills, save money, get in shape, and make new friends. So really, it's kind of, giving seniors access to so many resources for them. And in 2020, OATS, along with the support of the Humana Foundation, commissioned a comprehensive research study undertaken in this area. And we'll take a look at the next slide. Let me get over there. And I'm going to take a look at some of the key takeaways. There's a lot of findings that came out of that. And as you see here, this support, again, with the Humana Foundation, found that nearly 22 million Americans do not have broadband access. That's the elephant in the room. I don't think it's a surprise, but certainly it is evident now. And some of the inequalities and why is age. It's one of the strongest predictors, along with income and education, in correlating with residential non-adoption. Only 58% of Americans over 65 have wireline broadband internet, and 42% who lack interest at home represent the second largest group of Americans left behind. So essentially, it definitely demonstrated that there is a need, and we have to find solutions for this, as well as addressing all of the issues related to adoption and need and use and all of those things. Laurie, do you have any comments on that?
Yeah, I do have some comments on that. So first of all, it's possible that people aren't familiar with the various terms that are in the Oates report. One of them was wireline broadband internet service at home. And I think it's important to know that we're talking about, in that case, high-speed internet access. And we don't have to get into the downloads and upload speeds and all of that aspect of it, but it's important to know that if you're sitting in front of a piece of software that's running on the internet or a website on the internet, when you tap something on a screen and it responds right away, the odds are you're accessing the internet in your home through a high-speed, that is, otherwise known as broadband connection. The lower speed connections, like only using a cell phone, for example, or a smartphone to access the internet, or dialing into the internet with a telephone, or all those things were the opposite of broadband. So broadband really is based on the distribution of connections from telecom companies around the United States, and there is a push now by the federal government to expand that access. And so it will enable people to use systems in their home to their fullest capacity and get the data that they need when they need it.
Yeah, thank you for that. And I think all of us who worked from home for the last year had our own issues with, accessing what we needed from home. And the students who were forced to, take their courses online, many of them, again, doing just what you said, Laurie, trying to access their courses or their classroom from their phone. It's not just an aging issue, but certainly as we get more of the aging population in place, this definitely needs to be addressed. So great points, Laurie. Thank you. So we know that...
Okay, I'm just going to jump in one more point that I think is important to access, to understand for folks listening online. It's important to understand that the federal government is trying right now to distribute discount programs for access to high-speed internet in every state in the United States. Stay tuned for that. More and more is going to happen to make sure people can get access to the internet at the speeds that are reasonable for them and not the traditional $60 a month and up.
Mm-hmm.
So,
yeah, is that part of the infrastructure bill that's kind of trying to be pushed through? Is that part of that? The broadband?
Yes, it is.
I thought so.
Absolutely.
That's great. Wonderful. All right. So we know that connectivity is vital. And this year, certainly with COVID, the past year taught us many things. It is a harsh reminder of what connectivity to the internet and how vital it is. How many of you dealt with clients or families who were trying to schedule vaccination appointments online, which required internet skills, connectivity, patience, understanding? And what was the impact on those seniors who couldn't get online to schedule their vaccine? So I think that's a perfect example of some of the issues. And I'd love to hear from some of you down the road about what your experiences was with that. And, obviously telehealth became, finally emerged as a relevant tool in healthcare and accessing and helping people who cannot get out safely to visit their doctors. If they could get online and get that benefit, it could be very, very useful. So those are just a couple of examples of why this connection is so important. And there's so much more. As we look at this, we always talk about social isolation, but we have to look at the whole picture. Technology makes it easier for older adults to connect with their loved ones and makes life more convenient and whole. And interesting, much of the previous research on technology use among older adults has focused on the reasons why older adults do not use technology. Despite the focus, a growing number of studies revealed some mental health benefits came along with using technology and the internet more often. And older adults think technology makes it easier to reach people and to stay in touch. It also supports existing social activities with friends, conveniences, and it greatly outweighs the costs and challenges of technology. So lots to learn there, but we know that social isolation, being able to exercise, I do a lot of talks on fall prevention, and exercise is such a critical part of that, and seniors weren't able to get out to their exercise programs, but certainly if they could do these things online. And there's no doubt that music plays a vital role for people in their health. And so being able to, simply access music on broadband is a wonderful thing. So, it's much more than just the health benefits. We're looking at a lot of different things. And I know as far as, books on tape, I recently became a big fan of Audible because my vision isn't that great, and I love to listen to books while I'm cleaning and cooking, so I think that's a great resource. And then, of course, shopping. If you work with older adults on this call or you have families, you know the time that it takes for an older adult to get out to the store or even get to their doctor's appointment. So shopping is as important. Being able to get the things that you want, and certainly, I don't have all the data, but the statistics on grocery shopping delivery is phenomenal, and I don't think that will change. I think that's a great service if seniors can get online to order their groceries. I know I recently kind of a caregiver for my aunt, and I went to visit. She's 6 hours from me. I took her to the grocery store. It literally took us 2 hours to get through the grocery store. That was exhausting for her and for me. And we know that it's nice to be able to pick out the items that you want, but when you can't, getting the nutrition that you want and need is just as important as getting the health care that you need. So let's talk a little bit about what is the existing adoption. And basically, the recent data from Pew Research shows that older adults lag younger adults, understandably, by double digits on a range of technology measures. Internet use, there's a 23% gap, smartphones, 25, tablets, 19, and social media, 35. There are substantial differences in technology adoption within the older adults based on factors such as household income, and educational attainment. Those are two big factors that really do influence that. And we also know that seniors age 65 to 69 are twice as likely as those age 80 and older to go online, have broadband, and to use a smartphone. And I like the fact that we break these things down by age because, sometimes when we refer to older adults, we might think 50 plus, 60 plus. We know that each, somebody in their 50s versus somebody in their 80s, there is going to be a difference in their use and adoption. So I think it's important to really look at the numbers and how they break down in terms of the different age groups. I know that I'm in the upper age group now, so I certainly, wouldn't want to be clumped in at this point with someone who is 80.
I'm going to jump in one more time, and it has to do with a little back to broadband here. There is an article on the AARP website, and if those of you don't scan the AARP website for answers to some of these questions, you should take a look. But there's an article there called How to Get Government-Backed Discounts for High-Speed Internet. and there is a temporary program that will make $3.2 billion available to cut the cost of getting connected. It's dated May 20th, 2021, so it's quite recent. And it's definitely part of the third stimulus bill. But anyway, the website is getemergencybroadband.org, all one word, getemergencybroadband.org. So anyway, take a look. And in general, I would say if you're trying to figure out how to get access to some technologies, it's always worth a check of the AARP website because they try to aggregate this kind of information for people. And the other thing is that AARP has made it a 2021 priority throughout their whole organization to focus on connecting those older adults who otherwise have not been connected to the Internet. That's it for that.
Yeah, that's great, Laurie. There is a lot of resources, and if we're bouncing things that you can't remember, our emails will be in the end. We're happy to share these resources with you. We want to make sure everybody knows where to go and what's available for you to help your clients and your aging loved ones. So if we continue on quickly with technology adoption, again, just some of the statistics about what's available. And roughly 1/3 of seniors say they own tablets, while 1 in 5 reported owning readers. And this represents a double-digit increase since 2013. So we're definitely seeing a little bit of an increase. And 34% of Americans age 65 and up said they use social networking sites like Facebook and Twitter. And this represents a 7-point increase from 2013. So, I think data is good, but at the end of the day, it's just numbers, and how we deal with our own clients and our communities really is the most important thing. So we can continue to find ways that, can help reduce the barriers and get them access to what they need. So when we look at the barriers, of course, broadband access, number one. So glad that we really addressed that. I hope everybody understands that importance. And then there are substantial differences in technology adoption, again, as we mentioned before, based on factors such as the age group, the household income, and educational attainment, obviously. 81% of older Americans whose annual household income is $75,000 or more say they own smartphones, compared to 27% of those living within a household earning less than $30,000. 34% of older internet users say they have very little or no confidence in their ability to use devices or to perform online tasks. And around 3/4 of older Americans agree with this statement. When I get a new electronic device, I usually need someone else to help set it up or show me how to use it. Well, that's what we're all here for, right? We have to recognize, I think, the differences in older adults and understand that I think they are willing to learn, they're eager to learn, but we really have to support them. And I use my aunt as a perfect example, trying to help to break down her understanding of each device, and it requires a little bit of patience on everybody's part. And then moving on to barriers to adoption, again, the most simplest and the most important thing, I think, is they have to believe that it's useful to them. And just because we think something is important doesn't mean they will. That just goes back to autonomy for the older adult. So if we think something's important and we want to get, our client or our mom and dad on Facebook to look at pictures, but they're not interested, then they probably really won't adopt. Having access, having training, and then obviously there's a constant change in innovation. Just when you figure it out, there's a new download, there's a new resource. So let's just bear that in mind as we try to, help our older adults adopt to technology. Laurie, anything you want to add to that?
Yeah, there's probably a fair amount of things I should probably say here. So another report that AARP put out recently is about tech usage of the 50 plus. It was a survey they did, was published about a month and a half ago. I will put it into the chat box at some point, and so you can see the name of it. But one of the things that came out in that survey was that 50% of the responders said that they would do more with technology if they knew how. And I think that the questions are definitely that we're getting today are relevant to that as well. So training is a factor. Now, one of the organizations that is owns responsibility for the National Council on Aging, is responsible for the senior centers around the United States. There has been quite a bit of funding floating around related to the Older Americans Act, and other issues related to older adults that is attempting to throw more money into things like senior centers, which has in the past been a way for older adults to get trained by volunteers in their community. I would say the number one thing, though, would be to look for the AARP websites related to technology and anything that they mention about training. And the other important thing about AARP is if you can get in front of, if people can get in front of a computer, they should take a look at AARP's videos, which are all online, that are video-based training. There's quite a bit of material on their website, how to use this device, how to use that device, how to do more with your smartphone. That's available from them, and they are trying to make sure that people know about that. And so before this is over, I will put more things into the chat box or the answer box. The other thing is quite a bit has happened lately in terms of innovation. I would say this year, the COVID pandemic triggered an enormous growth in interest among innovators to move forward with all kinds of technologies that could benefit older adults. I did just write a research report about the future of wearables, that is on your body, devices like smart watches and bands and smart jewelry and all kinds of stuff. But the idea is that innovators see the opportunity to get this technology in the hands and on the wrists of older adults. And so there's been a big growth in adoption of technology, but mostly a big growth in innovation by people who are trying to do more for this population. In my research report, I learned about new technologies for people with Parkinson's that could actually evaluate the gait of a Parkinson's patient, and as they walked around, possibly with changes in their gait, they might need to have their medication dose adjusted. That's an example. Another organization is working on research to anticipate, based on a wearable on the body, the likelihood of a person having a stroke. There's better technology today that's available in wearables to manage diabetes, including having to do far less pricking and what have you. People are doing more with patches on the body that can monitor some of these patches can last as much as 90 days without being replaced. So there's a lot of initiative on the part of developers to create new technologies that would be useful to older adults. The question is really just how to find out about them and to look for them. If people start searching online for information about wearables, healthcare, or any of the chronic conditions that I just mentioned, you will find quite a bit. The only other thing I would say is, well, I think that's it for that slide. I think we can probably go to the next slide. And I think this is one, April, you wanted me to talk about?
Yeah. Now we'll kind of transition to some of the different categories so that we can, give Laurie a chance to really expand a little bit more on the various categories, starting with safety and security.
So today you probably have heard of smart doorbells, but there's also smart systems that you can put in your house that will help automatically control temperature. So at certain times of the day, it will turn the temperature down, turn the temperature up, detect if there's something has changed in the home, whether there's an emergency and a need to get help. And so all of this technology is available today. It's important to understand that it's not infallible. It's a big improvement over what we had in the past. And I would say at number one, it starts with the concept of home security. Is the home protected at all by any form of home alarm system? And if so, what can be done to make that even more effective with older adults so that people could actually speak a request to something and have it respond. So that's the top left here, the ability to detect whether there's an emergency and get help using a smart home security system. On the right are those video doorbells where you stay in your chair and you can actually detect by looking at a smartphone, you can detect who's at the door, whether you actually want to answer the door. In the bottom left are the technologies that are really all about on the body. That would include a pendant around your neck, otherwise known as a medical alert or medical alarm, in which people have historically been using those as I've fallen and I can't get up. But today we have quite a bit of progress in that category, and it's now in the form of a wrist-worn wearable, so you don't have to deal with the issue of I forgot to put it on. If it's on your watch on your body, it can be very useful to you to be able to see and get notified. They can be set up, not necessarily by yourself, but by someone who's helping. They can be set up to respond to a voice command or to alert somebody if the device has detected that you've fallen down. And that's a big change. It's no longer just the bulky pendant that you wear around your neck. These devices become quite smart. They need to be connected to a 24/7 emergency response center to be useful to you. Or to be useful to older adults. There's no way you can just have a device and hope that you can call one of your family members and they will show up. That is a sort of a hit and miss methodology. And also a device that does fall detection like an Apple Watch, but that in fact if you fall, it calls the fire department. People don't want the fire department to be the first responder. They would like to have a service in the middle. And so that is something that it does cost money to have that, but that's becoming less expensive all the time. And then smart thermostats, as I talked about, being able to manage the temperature at home or in the evening or when you're away from the house. So we go to the next slide. The next slide is some examples. So the top left one at the top is mobile help. That is a personal emergency response technology that you can wear around your neck. It's a traditional pendant type device. Below that is Fall Call Solutions, which is software for the Apple Watch. So a growing percentage of the population is getting Apple Watches at the age of 65 plus. And the Fall Call Solutions software enables you to if you fall, it contacts a call center, and then the call center contacts you and says, is everything okay, or did you fall? On the right of that is Unaliwear, which is actually a fall detection watch that can enable you to be out and about, and if you fall, it will call a call center, and a responder will respond through the watch and say, are you okay? Otherwise, should we send help? Below that is another traditional personal emergency response system that's called the Freus. Freus is the company, F-R-E-E-U-S. The product is Bell, B-E-L-L-E. That's another sort of traditional put it in your pocket or wear it around your neck pendant. To the left of that is Trellaware, which is a piece of jewelry you wear around your neck that has a button on it that you can press. And it's the woman who designed that is looking to make pendants around your neck more attractive. Below that is the Philips Lifeline product, which Philips has sold that business to Connect America. And Connect America is now going to be the provider of the services to all those who own Philips Lifeline products. And also Medical Guardian is one of the big providers of the personal emergency response service and in a variety of form factors and can help older adults who either whether they're in the house all the time or whether they're out and about, both types. And on the bottom right is a smart scale. This particular one is the Zibrio Smart Scale. And this is an interesting product. It's useful for changes in a person's stance when they're standing on a scale over time. It's a smart scale, and it can detect if something about you has changed when measuring your weight. And, of course, it has to transfer your weight to another system. Let's go to the next slide. So the first thing on the top left of this is a MedMinder pharmacy, which is the ability to have a pre-filled dispenser environment like you see in the screen with all of your medications. A new refill is shipped to you periodically with your medications in it. Your doctor has to call in these prescriptions or submit these prescriptions to this MedMinder pharmacy program, but all the doses can be then sent to you shipped to you, I guess. To the right of that is a medication dispensing device that kind of looks you in the eye and says it's time to take your meds. It's called Priya. It's a smart medication dispenser. Next down on the left is the Hero medication dispenser, which is very similar to the MedMinder idea. You press a button, in this case, and out comes a pill. And Amazon has done quite a bit of thinking in this area and has come up with this pill pack thing where all your doses are sent to you in little packages and you are reminded when to take your pill. The last one at the bottom is another one of these dispenser type things called MedAlert dispenser. If you go to the next slide. These are engagement technologies. So we just covered medication adherence. This is engagement. And engagement technologies includes a variety of them these days, including the GrandPad tablet, which is an easy-to-use tablet for older adults who are not comfortable with an iPad or an Android tablet and want to have a simpler user interface. And then to the right of that is an interesting product, and you may have heard about it. It's the Joy for All robotic pets. These actually can be purchased in a pharmacy, actually, or a department store. And these are pets that sit in your lap. They're cats, dogs, and they have another one coming out that sit in your lap. And based on your touch of the animal will move in the lap of an older person and purr or bark or whatever is appropriate, and continue to move around as the person continues to touch the pet. It's been proven with this tool that it is very helpful to people with dementia. Mm-hmm. And the Amazon Echo Show. Anybody want to jump in there? Okay.
No, I'm fascinated by that one.
You're fascinated. It's a very cool product.
Yeah.
The Amazon Echo Show, which is has a screen to it in which you can speak to the screen in your house that is connected to the internet, and you can ask it questions. You can ask it to display a recipe. You can ask it to show a video. In fact, it will show a video of a recipe, how to make something. And then to the right of that is another interaction tool for people who are isolated and at home alone. It's called OneClick.chat. And then it's Never Too Late, a company that's been providing technology to nursing homes and assisted living facilities for many years, makes a tablet that can be used in individual homes. And that's what it looks like. It's called the It's Never Too Late IN2L tablet. Go to the next slide. We have a lot of caregiving tools that are shown on this slide. I don't know that we want to go through all of them. These are, really focused on sharing or finding care, or training caregivers. In the case of Embodied Labs virtual reality tool, training caregivers, finding care, sharing care with other people where that's required. April, we'll go to the next slide. I think that goes back to you.
Yeah. So, obviously there are so many resources out there, and we have Laurie's website along with another one on here that I think it's my go-to place when I'm looking at what technology is appropriate and what is the opinion of experts. But you do need to evaluate technology, and it can be as simple as talking to references. Are there other people using this product similar to, the age and the scope of my loved one? So talking to other people who have actually used the technology. Looking at reviews. Just like anything else we're going to purchase, we want to understand what are other users saying about this. And then also understand the setup requirements and the support, because that's the ongoing issue of making it feasible and getting the adoption that we need from our older adults. Is we don't want to leave them with complications. I go back to my aunt and all the issues that she has with technology, and every time I'm at her home, she's got 16 notebooks with 243 passwords. And, just trying to simplify the process for her really helps her, to feel less frustrated. And, she continues to think it's an aging issue, and I try to support to understand that, no, everybody has these issues. We have to figure out, how things work and how to best manage them. So I think it is important. There is a lot of technology, and, I think another thing that's not on this slide to think about is this new technology that's not even being deployed yet? Because sometimes we hear about things that are new, they haven't really been deployed or used amongst older adults, and we didn't get into that much on this particular presentation, but I think, how do they test the products? If they are introducing new technology, are they actually using older adults to use the technology, or are they using younger people? So how that innovation is introduced and how it's studied, everything from, are the buttons large enough to see, is it intuitive? All those types of things are very important. I remember back in the early days of medical alerts, there was a large red button on top of the machine that said help. And that was easy to see, right? So somebody could be very clear on how they could push that button for help. But nonetheless, it also created a stigma, and seniors didn't like that. But companies who develop their technology and test them on older adults are going to know more about the design features and the usability. So those are all, I think, important things to ask. Any other 2 cents from you on that, Laurie? I'm sure you could talk for hours.
Yeah, no, it's important to ask for references when you're talking to a company. If you're talking on the telephone to some company about a possible technology, please ask for references. That is, the names of other organizations which have recommended it. Otherwise, look around in your own geography for people who can help you. In general, most people live in an area where there's home security companies that support home alarm systems. You might find in your own geography that there's training programs available. All of the AARP information that's online about how to use various technologies does not require you to be an AARP member, so you can definitely look online there. I would say if a technology is not widely described on the Internet, you do not want to be the first person to acquire it. You want to,
right?
Yeah, don't be the first. It's not good for you.
Yeah.
Yep.
All right. And a call to action. I think it's important as we talk about this, as we mentioned, there are some larger national initiatives. There's a lot of movement in the area of new technology vendors. But really it starts local, right? So many of you on this call want to know, what's it like in my community? How can I get these resources? How is it paid for? So I think it takes the national initiatives, but then we have to break it down into our own communities with our own resources and figure out how we can best help. So spreading the word about what is available, such as the OATS program and Senior Planet, all the resources from AARP that Laurie mentioned, and then doing our own, filling in the gaps ourselves. I think we're all providers serving older adults, and I think that's where we can contribute. And so I appreciate that you're here today to learn more about this topic and to start to formulate your own ideas of what you need in your community. And I want to finish with this quote. I fear the day that technology will surpass our human interactions. The world will have a generation of idiots. So technology is great, but human interaction is important, and that's where we come in. So I appreciate that you were all working with me or patient with me as I had technology issues in the beginning, but we'd like to answer some of your questions now. We have a few minutes to do that, and I think what I can do, if it's okay, Laurie, I'll just kind of go through some of the questions here, and we'll work through them as quickly as we can. Does that work for you?
Yeah, I'm answering some of them as I can in the answer questions. So I'm trying to catch up. They will show up as answered once I get the answer in there. So I'm going to answer to all viewers that one. All right, got that one out. Okay. So, so let's go through the questions.
Yeah.
Go ahead.
All right, I'll start with, we'll move as quickly as we can. I guess the first one that I'm seeing is what protections can be put in place to prevent seniors who use technology to meet friends from becoming a victim of fraud or scam. This is near and dear to my heart, and it's an important one. And I guess when I look at it from my perspective, we have to, first of all, respect the autonomy of the older adult, but we also have to educate them on the risks. I've mentioned my Aunt Joy many times. I'll mention and have her permission to share that she was scammed online by somebody from Africa. She sent money that she did not have, and that will never be recovered. Could I have stopped that? I doubt it, but I continue to do a lot of education with her because, first of all, we do have to educate on this, and that's where you and your community can do that. But we also have to respect the autonomy of our older adults. So that a lot of that depends on their cognitive abilities. And Laurie, I think that like devices like the GrandPad can actually limit some interactions or some access. Is that true?
It can. It is limiting some access. That's sort of the whole point of it, is to not enable. So I just posted into the answer for everybody on that the guidelines from the Federal Trade Commission on protecting from scams. So please grab that when you get a chance.
Yeah, that's perfect. It's a complicated subject, but one that's definitely worth addressing. Let's see. Let me see if I can get down here. Thank you, Abby.
I also answered the ARP one. I answered the one about my report on wearables. I've already answered that one, which is where the wearables report is.
Laurie, do you mind sharing some of the answers that you have, just so all of the audience?
Verbally?
Yeah, that would be great. Okay,
so I can't now remember what I've answered, but I did answer. I answered. I provided a response about AARP. You do not have to be an AARP member to look at the videos or look at the information that's on aarp.org. So that's not required. You can get on there and search, and you can find all kinds of things that are useful, specifically looking for smartphone videos on smartphones, or videos on tablets, or videos on scams, or information on scams. AARP has updated quite a bit of information on protecting yourself from scams. So is the Federal Trade Commission. I did post that. That is, the Federal Trade Commission has information. If you just look for FTC scams, you'll find a lot of information from the Federal Trade Commission on protecting yourself from scams.
Laurie, you can go to the Answered tab, and then it'll show the ones that you've answered, if that's helpful for you.
I hit what? Oh, answered. Okay, good. That's good thinking. All right. No, let's see. I don't see what I answered. I did type to all users. So if you can see those, maybe you can show them. But I did type to all users. So I think anyway.
And we'll just bounce them out loud. Are there any medical alert systems that are available for low-income individuals? There's another similar question for people who live in areas with reliable internet. I know that, well, Laurie, you can answer that one. I'll just bounce real quickly that many times your local area agencies on aging do have programs that will help pay for those systems. And there are a lot of options now in areas without internet or Wi-Fi. Obviously, they get a little bit more expensive. Laurie, anything else you want to add to that?
I would say, well, if you're talking about the medical alert, the discounts for medical alerts, so Medicaid does provide some level of access to medical alerts, and many senior living communities and nursing homes give them for free when people move in. It's just a question of, again, unfortunately, the biggest solution to all of these problems is searching the internet for answers. So,
it varies by your community for sure, but I would start with your area agencies on aging, any waiver programs local county programs. I know specifically in Ohio, where I lived, that was a very robust program and very well received, so seniors could get the medical alerts. There's a question 39. What are your thoughts on LEQ? Are you familiar with that? LEQ?
LEQ is the robotic. It's a robotic device that sits on a table and interacts with an older adult. It's kind of cool. I would call it in the kind of cool category. I am not suggesting it because I don't. Well, some people are giving it away for free, depending on the type of organization. And if it's free, it's worth use. If you have to pay for it, I'd say it's not necessarily. The whole idea is that it makes eye contact with the person and tries to detect if they're lonely or sad or whatever, and interacts appropriately based on that. But I would say, in general, that's a little advanced for what most people need in the way of interaction. And I would start with that robotic cat or dog. If people are lonely or isolated and they don't know about this robotic cat or dog, that company is called Ageless Innovation. But it's the Joy for All Pet is the name of what it is. It's Joy for All Pet, and it's $99, which is a one-time purchase. So it's pretty cool.
That's a lovely gift.
It is a lovely gift. I'm back to, okay.
Okay. There are a couple of questions on, can these devices be covered by insurance? How expensive are these items? I know we're running a little bit out of time, but in general, how would you answer those questions, Laurie? Expense and coverage by insurance.
Some things are increasingly likely to be covered by insurance. Including so Medicare Advantage plans, for example, might cover medical alerts, and they will definitely cover, and insurance will definitely cover telehealth visits, visits from your home where you're talking to the doctor through a smartphone or through a device. Basically, you have to look at each insurance plan and check to see what it covers, but in particular, Medicare Advantage plans are increasingly interested in the use of technology to help keep people out of hospitals. All
right. Well, on that note, I think we went through a lot of questions, and we certainly want to be available to you. So at the end of the presentation there, I think you should have both of our emails. I encourage you to contact us. We'd love to hear from you. I know that we're both very supportive on spreading the word on how technology can help and then how to better evaluate and get seniors to use. And we thank you for everything you're doing in your communities because, again, I think it takes that grassroots effort to really make a difference. And Laurie, anything you want to say as we close?
No, I just think we are in a time now where, especially with so many people having been isolated for so long, that the technology use is an enormous opportunity to mitigate social isolation. And it's important that people who serve older adults, who have family members who are older adults, look for ways to get technology into their home. It doesn't necessarily have to be super expensive. It may be subsidized, increasingly likely by the federal government. It may be subsidized, and you should really keep your eye out for the possibilities, whether it's related to smartphones or fall detection or personal emergency response pendants or tablets or whatever it happens to be. Keep your eye out. There's a lot of opportunity.
Thank you. This was a lot of fun. We're so glad you were here with us again. Thanks for bearing with me in the beginning with my technology issues. And we appreciate everybody being here today. Thank you.
Thank you very much.
Yes. April and Laurie, thank you so much for presenting and sharing all of this helpful information. If you'd like to claim CEUs for today's webinar, you will be receiving a follow-up email by the end of the business day that will contain a link to the CEU application. That follow-up email will also contain a link to today's slides. Please note you have 60 days to claim CEUs for today's webinar, and please note it will take 30 days from the date of your submission in order for us to process and issue your CEUs. Thanks so much for joining us today, everyone.
Thank you. Bye-bye.
Thank you.